familiar with it are the citizens, and the citizens can be because it's part of the federal protocol. Now, there's one other piece.
Okay.
As a part of Presidential Directive Number 8, there's a what's called National Priority 4.8. You can look all this up on the internet.
All right.
And in that, this is a statement that was first provided by the first Homeland Security Director, Tom Ridge. And it's been adopted all the way for presidents, including President Obama. In this Presidential National Priority 4.8, it is clearly stated that citizens, two things that come out of this.
Okay.
One, it's not enough manpower in government
Okay.
to address whatever the man-made or natural disaster is.
Right.
So that's a foregone conclusion.
Right.
They don't have enough manpower.
Right.
Okay.
So the people don't need to be waiting on the government when there are some tools that the community can do
Exactly.
without waiting on the
Right,
government.
of course.
Exactly.
Right.
I visited Guatemala, and in Guatemala, they make sure the people in the mountains are trained because there's a slow response time getting to the people
Right.
when there's a mountainside, earthquake, or whatever. So they train the people in
Right.
Guatemala in that sense. What we have to do inside Harris County and beyond is have more citizens that know how to work a ham radio and can communicate directly with the professional first responders to let them know where specifics.
Right.
Now, there's a lot of research done by Rice and the Speed Center, Rice University, University of Houston, and Texas Southern. Texas Southern has a Center of Excellence funded by the Department of Homeland Security. It's the Center of Excellence in Transportation. Now, everybody talks about evacuation.
Right.
There's not that I know of, unless it's been done in the last 12 months. There's not a reentry program if you are asked to leave.
Right. Right.
How you gonna get back?
Right.
Well, when they came back for Ike, trees were down, power was
Exactly.
out. There were no neighborhood alternatives set up to relieve the frustration of the people. And a community group can organize and cut the trees down and move some of the trees until solid waste, public works can get into the area.
Right.
Because they're going to be going, and they have a grid that and a process that they follow that may make them getting to you 2 weeks down the road.
Exactly.
Well, what's going to happen in between this 2 week
Right.
period?
Exactly.
So if you got a group of people in the community
Right.
that are connected by radio and they have these buzz saws, trucks, they can get it, and you
Right.
have a church
Right. Right.
Exactly.
set up. Well, this is what happened to us with one church, Good Hope,
Right.
Pastor Cofield's church. He had a couple of hundred people in his church.
Right.
This is Ike.
Right.
Power was out. He got a generator.
Right.
The generator came to his church, but didn't anyone know how to hook it up. Then when they got someone to hook it up, the part was in San Antonio.
Oh my goodness.
By the time they got the part and somebody to hook it up, the power was back on. So before the disaster,
Right.
let's identify
Preparation.
key churches,
Exactly.
Right.
retrofit them
Right.
with a generator
Right.
so that people with medical problems,
Right.
at least,
Right.
At least.
Right.
can have a
Right.
medical triage transport site that they can go to the medical center or whatever the hospital is.
Right.
But if the people in the community mobilize, they can set this up using this national framework and protocols that's established by the federal government.
Right. Right.
And it's free
Right. Right.
for the most part.
Right.
So these are some self-help ideas that are available, but most of the community is not aware of it. Council member Ed Gonzalez
Right.
is a strong supporter of the conference, and we are going throughout his district with meetings, getting people informed and registered for the conference.
Right.
Okay.
So we're doing that in 4 major districts. Councilmember Rodriguez, Jones, and Johnson. Adams and Johnson.
Okay.
Okay, so ours is one of them.
Yeah, yeah.
Right, right.
So what we're trying to do now is demonstrate. Now, the City of Houston Health Department has taken this whole prevention process to another level.
Right.
This system that the government came up with, the name of it is called National Incident Management System, NIMS. It's a management system. So it's not just for hurricanes.
Right.
It's
For
a management
agent
system.
Right. Right.
Now, here you have a management system for civic clubs. If they take these courses, it's just like having a certification in business management.
Right,
It's a
right.
management system.
Right.
All right.
What the health department did, City of Houston Health Department did, and under Steve Williams, the director, they used the system on a day-to-day management process, but they also, that's horizontal,
Right.
but they've also implemented as a vertical service delivery tool.
Yeah.
And that means you can drill down to the people who have been identified as vulnerable
Right.
in our communities. And this is not a knock on any of the large NGOs, non-governmental organizations, but a lot of people don't see United Way
Right.
in the Black and Hispanic community.
Right. And I
They're not
agree.
there.
I agree with that.
Exactly.
Yeah.
Exactly.
So if we
Right.
connect with this process, it'll help us connect with those large agencies so it can make the recovery process easier and the service delivery method back and forth easier. So this whole thing started under Lee Brown.
Right.
Lee Brown commissioned me to do a survey. We did 120,000 surveys out at 22 different zip codes in southeast, and east. And when the surveys came back, it came back in two categories. Those who were identified as special needs and needed some assistance, whether it was transportation and all of that.
Right.
And that 211, that's a whole nother discussion, but you have to be aware that 211, you have to, the emergency transportation system for the state, people have to register for it every year
Right.
if you have a transportation problem when they do call for an evacuation. But this survey that we conducted was before the whole system.
Okay.
So it was vulnerable populations or special needs. And the other one was the people in the community responded that said, I don't want to be a part of National Night Out. I don't want to be a part of the Civic Club, but I have a boat. If you need, I'm a retired nurse. I will help under these circumstances. I will help, but I don't want to be necessarily a part
Right.
of this.
Right.
But I will make my service
Right.
available in my neighborhood
Right.
if I need to.
Okay.
Right.
So this is the basis of this, and this happened in 2001. Okay, when we did the survey.
Right.
Before 9/11.
Okay.
So there are a lot of opportunities for the community. The churches would bring them closer to the civic clubs and the
Right.
homeowners
Exactly.
association. It would even bring them closer to the schools that's in their neighborhood.
Right.
Exactly.
So it's an alignment process. One of the best groups that work with us is the Tejano Center,
Okay.
Richard Farias.
Right.
And we have done several things in that Broadway area with Richard Farias
Right. Right.
that is clearly a benefit to the community. And this is the message that we are trying to bring out for neighborhood people. You cannot wait for the government to do everything. They don't have enough money and they don't have enough manpower.
Right.
There are some steps that we can take that we're going to provide at this conference that's going to connect you to the fire department, the police department, and the health department in a more organized fashion. So whatever your disaster is, fire, cold, heat, hurricane, flooding, doesn't matter. You will have a system to address it that's going to help your neighborhood.
Right.
Because most of the material that comes out from the city and the county is your individual.
Right. Right.
Get ready.
Right.
Get your go kit package. You
Right.
get out.
Exactly.
Okay,
Exactly.
go.
Exactly.
But there are some people that's not going to leave.
Not gonna leave. That's exactly right.
You remember
Yeah.
when Ike hit?
Yeah.
You, myself,
Right.
and Congressman Green
Right.
rode around until 11:30 that night.
Right. It's exactly
We
right.
found 5 churches open.
Right.
Now, the county didn't know they were open.
Right.
The city didn't know they were open.
Exactly.
The community didn't know that they were open. So if we can organize around people's taking their own initiative.
Right.
It's going to make the conditions safer and healthier during that time of need.
Well, that's good. So you're saying to the viewers that it's important that you seek out information rather than wait for somebody to bring information
Correct.
to you. Why don't you tell them again about this conference? Kind of let's really focus on the conference and the importance of being at that conference, because what I'm hearing is some of the things you presented to the viewing audience today is going to be done at this conference.
The conference is going to be April 17th through April 20th. The conference components will be, we will have an international component to it. We will probably have in excess of 15 different consulate generals or embassies that are attending the Sunday part of the conference.
Okay.
Saturday, we will have certification classes in these classes that will help citizens organize in the neighborhood.
Right.
Then we're going to have on the next day, we're going to have the same classes, and we're going to have what we call a tabletop exercise. We're going to do, we're going to have 4 scenarios: medical and health, schools and universities, private sector and government, and community and faith.
Right.
Each section will have a demonstration project in the neighborhood. It's going to be an exercise.
Right.
It's going to be a disaster exercise in 4 different categories and the attendees are going to be manning and staffing the exercise with the fire department, with the police department, and with the health department, and the school district, and the university.
Right.
Texas Southern, North Forest are 2 groups that we have identified. MD Anderson, we're waiting to hear from Harris County. They participated last year. Harris County Emergency Hospital District, emergency management participated because we had a St. Joseph's Hospital.
Okay.
St. Joseph has one of the best decontamination units in this region.
And nobody knew that.
Nobody knows that.
Yeah.
That is an area, that is the place. It is a Homeland Security designated site for decontamination. So one of our exercises last year, for an example, was a chemical plant explosion. And you got a lot of chemical plants in Baytown and Houston. Galena Park, Pasadena, just in the city. And so we had a chemical, so we set up the triage. And these are citizens are working right there with the Red Cross and the fire department, triaging the injuries.
Right, right.
And then we transported them. Metro participated. We had put the injured on the Metro bus, and with a police escort, we went to St. Joseph's Hospital. And when we did the Tejano Center drill, they went to LBJ Hospital.
Right.
So these are some of the examples of what we will be doing at the conference. And the city council people will be helping us organize. And just call your city council member to, or either go to our website.
What is that? The address to the
Crown Plaza Hotel
Okay.
on 610 in Kirby is where we're going to host
And
the
give them the
conference.
dates again, Charles, because we want to make sure that they get the dates. The dates for this conference is going to be?
The dates for the conference will be April the 17th through the 20th at the Crown Plaza Reliant Hotel. And this is Working Together for Readiness 3, Public Safety, Public Health Conference. And it's designed to empower, train, certify, and do exercises with civic clubs, churches, homeowners association, small business people, and medium-sized business people that are located in a neighborhood. And the outcome of this conference is that they will have a clear linkage with their local fire, local police, and local health department to help mitigate risk factors for all hazards year-round in their neighborhoods.
Well, that's good. I don't want to say this. I'm gonna let you have it because
we're
I want the viewers to know.
just about out of time. We're just about out of
I'm going
time.
to attend that conference. I want the viewers to know I'll be at that conference.
Okay. We want to thank you all for joining us today. We're just about completely out of time. We've got, just tons of information that we've gotten today, and we want to thank you, Mr. White, for being here with us today. Thank you, Pastor Nash, for being here also, and we surely hope that this information has helped someone out there. Again.